format because we've done these chamber chats with speakers, intentionally bringing some speakers in, but this is kind of some important information stuff that a lot of businesses have been waiting for. And so we have a tag team approach. I always say we have a whole slew of people that are working hard. I just become the unfortunate face some days of the chamber, as many of you can relate to. It's like, oh, do I really have to be on a meeting today? And here we all are. So let me get things started. First and foremost, the main news of the day is Governor Evers had a news conference to talk about what many businesses initially, tail end of last week, were saying is, hey, Governor, we need to see some metrics here as to what it looks like. What are we shooting for so that we can reopen? And so I know Angie was on part of that news conference, but Beth on our team really spearheaded that. So Beth, you want to talk about, Beth Franklin, you want to talk about the Badger Bounce Back and then also the WEDC component of that?
Sure. Well, welcome everybody. I'm just going to share my screen here. So to find all the information, as usual, you can feel free to go to our chamber website. To access the information that we're going to get to today, you'll go to our daily chamber email from the COVID page and then the chamber chat for today, 4/20. And a lot of the information is here. So let's start with the big news, which is the Badger Bounce Back Plan. So there are two big documents that were released today about Badger Bounce Back. One of them is quite a few pages, 6, and then there's a two-pager that's a little bit shorter with more highlights, but essentially Badger Bounce Back is the new plan. And I'll just scroll through. I think one of the most important pieces is the gating criteria, and this is kind of what's going to be determining how we move forward to go from phase 1 to phase 2 to phase 3. So this mirrors very similarly to the White House's plan to reopen America. So a lot of this information is coming verbatim from there. So these are some of the really key pieces. So a downward trajectory of influenza-like illnesses reported in a 14-day period, and downward trajectory of COVID-like syndromic cases. And additionally, not just a downward trajectory of tests, but as a % of total tests in 14 days. And then it's also how the hospitals are able to handle, so how they can treat within the crisis. So the gating criteria determine everything. So in a lot of these documents, you'll see gating criteria, and this is what they're referring to. So 3 core responsibilities for the state: testing. So the big news that came out today is that they want to implement 85,000 tests a week, and you should be able to get your results within 48 hours if you are COVID symptomatic and are tested. So there's a lot of information specifically about what that testing looks like. Then there's the tracing component, which is also key. So you can't test and then effectively work on this without the tracing. And so hiring 1,000 additional staff to try to get everybody contacted within the 48-hour window. And then further tracking about how this is traveling throughout the state. Other state responsibilities outlined are a lot about PPE, getting PPE to our healthcare workers and safety agencies. And so you can all look at that. Then they list individual guidelines, and this is what we've been hearing constantly about practicing good hygiene. And then employer guidelines as well. So a lot of employers are already implementing, but it's basically just put forth here in the Badger Bounce Back Plan. And then the page 5 of the Badger Bounce Back Plan is really, the first page is of the chart is really just about personal care and kind of personal responsibilities, what we're doing for ourselves as individuals for the most part. And then when it comes to businesses, the very last page of the full 6-page report is really where a lot of information comes forward. So phase 1, again, you see that word, that phrasing, gating criteria, phase 2, phase 3, and then along the left, the timelines essentially for opening restaurants, bars, schools, things like that. So there is a good 2-pager that's kind of the real quick version of it. And page 2, to pass along, I don't know if you, a very simple graphic if you wanted to pass along to your employees or something. This basically outlines that 6-page document in a really clean graphic. And then another very big piece of this is WEDC, kind of speaking from the business side. And they are Wisconsin ready. So as part of the Badger Bounce Back Plan, Wisconsin ready. So it speaks to rolling up our sleeves, investing and sharing the commitment. And so the current work is listed here, and then what's next. So the real-time data is key. And so working with the county health departments will be vital. Guidelines by industry for coming back online. Multi-sector task force to advise. Restart 72 is about how to get our counties kind of opened, working on helping people get access to federal funds. And then this one is key, fostering a united response to Wisconsin's economic resurgence among businesses, communities, and citizens. So WEDC is working on leading the Badger Bounce Back Plan. And like I said, those documents are found here on the website. So I will turn it back to Vicki with that.
Yeah, the piece that I think I heard was WEDC is really that business focused. What do we need to do to get our businesses ready, which is why it's phrased that way. And so what do we know from what Beth just ran us through? We need to be looking at our trends. And so there is Department of Health has, I'm sorry, this should be the county side. I think I may have put the wrong one up here. Maggie, if you're able to bring up the county health page that has the current number. So where we're at essentially with the county, as many of you know, we have 26 cases right now. We have gone, I believe, a week now without another positive case. And what they have emphasized is obviously the more you test, the more positives are going to come forward. And so that's something that we need to realize is going to happen naturally, because that's just a matter of statistics. And so they are right now not testing everyone. They have some screening as to who they test and who they do not test. And so thank you. So yeah, there's the 26 cases, 23 of those have recovered. You can see how many have had negative tests. And so again, we expect those numbers to go up, and that's an important part of, again, more testing results in more positives. The other piece that I know Beth took a look at for us was hospital capacity. There is a website, it's a DHS website. If you can find that for us, Maggie. I always love to give the analogy of the Wizard of Oz. So there's somebody behind the curtains that's making everything one, and that's Maggie. So, so this is a website, again, another place to monitor some of those statistics, but it'd be great to start compiling them for our county, particularly. This shows, as soon as it loads, different hospitals. It's by region. And so you will have access to that website and can look that up, but it essentially shows where our hospitals are performing, because I shouldn't say performing, what their capabilities are because of COVID. I don't know, Maggie, if you can try to refresh that, if that's going to do any good whatsoever. But anyway, that link is there. And so compiling some of this is a next step that we can be taking a look at. Beth, any remarks? Because you have actually seen that map. Anything strike you?
Yeah, do you want, it's actually, do you want me to share my screen? Because I have it up.
Yeah, go ahead.
So this is the breakdown that Maggie wasn't able to bring up, and so it does talk about bed availability. Ooh, maybe they have a lot of traffic right now.
Mm-hmm.
So bed availability for statewide, but then you can also go to the county level, and it will give you that data, or it should. It was earlier. So the key pieces are, again, some of the things that drive that data for getting into those gated criteria. the testing. One of the pieces of that gated criteria is the number of people in ICU beds and making sure that there are enough beds and hospital staff and supplies, period. And so some of those numbers for that third piece of the gated criteria come out of this data that you can find on the DHS website.
And I'm going to do a housekeeping thing here because I have learned there are people on the webinar, if you will, the Zoom meeting that are better connected than us sometimes. So just a reminder of that little chat button down. If you're on a desktop, it's a little conversation bubble down at the side. So what we have not heard, unless someone has heard otherwise, is that this safer at home order could release county by county. I know that it has been brought up in several state conversations as to whether that can happen. And we're crossing our fingers that it can. And some people have said, well, what sense does that make? Well, remember, this is a dial is the analogy that's being given. So if you move the dial to 1, you're probably going to start bringing back together people that aren't necessarily going to be a business that's going to attract people from outside the area. So how do you start to open up on small scales and see what starts to happen with those numbers? And so I was on a call during the governor's with the county health department. And some of the things, again, they mentioned the more we test, the more positives we will find. And each one of those, remember, every positive, they have a tracking component that they have to do. So where did those people go? Who did they come in contact with? And that is extremely labor intensive. That's the multiplier effect, right? Every one person might have 50 people that have to be contacted. And they did talk to me about a soft reopen. So the things that they can control, campgrounds. So campgrounds are actually a residence for some individuals. And so they're seeing the need to reopen. They're also looking for, are there other businesses that could do a soft open? Not necessarily, I was stretching a little bit saying, are those the ones that are only under your control? Or the point is, how do we start identifying those businesses that can open easily? What came up particularly was, it's the, for lack of a better word, it's not the new normal, it's the transition to normal is how I like to look at it. So they talked about, we want to see businesses with the hand sanitizer. We want acrylic barriers put up. We want signage that talks about capacity of who can be in the store at one time and how that's being monitored. They want to look at the physical distancing actually taped off on floors and demonstrated. And the last piece that, particularly on supplies that they talked about, is they have on their website, Maggie, I don't know if you can bring up their website again. It's under the resources tab, but they are heavily emphasizing that everyone wear not medical masks, because obviously we need those for the medical, for the hospitals, but we should be wearing cloth masks. And my immediate response to all of this was supply, right? Nobody can get hand sanitizer. How can businesses get cloth masks, which are pretty much homemade? And I honestly think, as I was trying to brainstorm that, I think there's some community outreach that we could be doing, saying if we want our businesses to get back into business, how do we get more people making these cloth masks for businesses and for individuals? And obviously the big talk right now are the individuals that are asymptomatic. So obviously you could be one thing with COVID is you're walking around and don't know when you are the most highly contagious, you show no symptoms. And so again, that's the idea behind the cloth masks, is to make sure that you're wearing them. So yes, they have, Maggie has up on your screen here, that they are recommending all people cover their faces. And they have other suggestions for what to use, but there's also a click here right below that graphic that's for a video on how we can get people to make their own. And so I'm going to be exploring, as we have this huge public swell of wanting to support our local businesses, what does it look like? We've been talking about it's tough to figure out the financial gap right now, but this is something we could ask people to be doing to help is, could you please be making some cloth masks and offer those to the businesses? We could be surveying businesses to see how much they need, how many they need. We could be gathering the demand for hand sanitizer and figuring out how to make that happen. There's some things we could be doing in bulk. So bottom line, we'll be exploring that. Other part of the conversation with County Health Department was they mentioned unified messaging. And I said, what is that? That's an internal term, but what is that? And they said, what they do is every inquiry that they get, and they get a lot of inquiries from businesses, they discuss as a group so that they are creating unified messaging going out to those businesses. And so the benefit of being on the call with them was, I said, could you please just put that out on your website? Because that will help you avoid a ton of phone calls with the same question. Is again, the more they can be putting out on their website, and they agreed to do that. The other piece that they have, which is really helpful, is best practices. So we had talked in an earlier session about how do we get one-way aisles. Again, that makes physical distancing easier if everybody's moving in the same direction and not trying to pass each other in a narrow aisle. Also questionnaires. It's the questions to ask employees every day as you're trying to help them self-assess. Do you have a fever? Do you have a cough today? They're going to share out the questions that they ask their employees. And they're also looking at best practices for curbside pickup. So I did a curbside pickup last week. Grabbed the pen from the guy, kicked myself. It's those little things of how are you actually sharing objects with other people, but they also recommend, again, cloth masks for those curbside pickup. How do you process credit cards without no touch, those type of things, or minimizing touch. And again, the emphasis is on those cloth masks. So moving us off of that onto Safer at Home FAQs. Maggie, I'm hoping you can bring that up too. What I learned today, and some of you may have already discovered it, again, the Safer at Home 2, as I'm calling it, has a whole other round of questions that come with it. And so similar to the first time around, there is a frequently asked questions that was released by the governor, and it really helped clarify, even for me, some of these questions. So as a, for example, a person who mows lawns, there's a component in there. Again, it runs you through, these are what these businesses look like and how they operate. So Maggie, if you don't mind scrolling down, there's actually, as a, for example, there is a lawn care component. Keep going, keep going. Keep going a little bit more, pages and pages, but you'll find the stuff that you need in here. Anyway, I'll just explain it. So there's two components to lawn care, as a for example. So the lawn care that is needed for health is allowed, and that person can go and do that. It's what they consider optional or aesthetic. There you go, right in the middle of the screen, perfect. The optional or aesthetic lawn care is where they don't, that's not considered essential. And this order is a little bit different because they have said businesses that operate, you can only operate to service essential businesses. You should not be then picking up your residential or private side of your business. So this runs through a lot more details in the original order, and I would highly recommend this. Read through this to make sure that that is answering some of those gray areas. And we're also looking for, again, the best practice is how do we get every single one of your businesses realizing how do you operate in reverse of what just happened, right? So we went initially to no meetings that have 50 or more people at it, and then down to 10, and then we were remote working if we were able to. So how do we reverse this out, and how do we do it in ways that have the masking, have the hand sanitizer, have the acrylic barriers, have the signage out there, have capacity very clearly worded, and then understand that that's going to gradually open up if we can all almost make a pact to do this by, as I've been saying, the rule book, because we need those medical numbers to change so that we can open up more. Shifting gears from Safer at Home, two more pieces to make everybody aware of. The U.S. Chamber Foundation has created funding for small businesses, and in almost every funding website, there's this crash, just like SBA's, just like WEDC's. And so the U.S. Chamber Foundation, though, again, Maggie's going back to that chamber chat, and we'll put this all in much more public places, but Chamber Chat is the place to go for today, and we'll be getting that out via email if we haven't already. So that is the link, thank you, Maggie, to the Chamber Chat and to the U.S. Chamber Foundation. And Maggie was highlighting there's $5,000 of grants available, and you can see the criteria there. So it's really pretty small businesses. And then last but not least, per the Wisconsin unemployment website, they are finally going to have their application updated. That is also on that chamber chat. So tomorrow is the day for the self-employed, the independent contractors, the people that don't have a steady job history, etc. So that will be another interesting swell, if you will, to a website that everyone has been waiting for. So that is the main highlights from what we have. Maggie, if I missed anything big on the chamber chats, certainly pipe in here. And don't forget to, we have chamber chats at 3 o'clock next week, which you can see in here. There's a personal finance piece. TrustPoint is helping us with that. TJ Brooks, who usually does the economic indicators, is coming on, and I believe that date is Wednesday. That is this week. Did I say next week? Wow, crazy. So that is this week. So we have the chamber chat tomorrow. We have TJ Brooks coming on, and then leveraging your PPP funds with Ed Jekyll. So what that one is it's really important for anybody who's doing those payroll protection program, whether you've gotten it approved or hopefully, fingers crossed, our feds come up with more dollars, because that PPP funding is gone, but we anticipate there will be more money coming. But what's really important with that is particularly restaurants, retailers, that they're using those dollars, applying and getting those dollars as they're coming out of being closed, because the clock ticks. So once they take those funds, there's 8 weeks to get their payroll to the point that it needs to be, so that those loans are turn into a grant as opposed to it staying as a loan. And those are partial transfers, so to speak. So what I mean by that is, if you only get your payroll up to 75%, 75% of that will be a grant, but you're going to have a loan on that 25%. And we are aware, and we love this feedback from everybody. Essentially, we are aware that the unemployment is causing some issues with businesses wanting to bring people back. Because the people are saying they make more money on unemployment, which is unfortunate, right? That's not the goal of unemployment. We need to get those people back into work. And so that component's going to have to get addressed as well, as our businesses are trying to ramp up. So I am not seeing any questions or anybody correcting any of my information, which is always a good sign, in the chat. Anybody have questions or comments? I also welcome you to unmute. We have a pretty big group here, so hopefully we don't stumble over each other, but anybody have verbal comments, questions? Quiet group. Okay, well, we will keep you updated as we're learning more information. Again, the next big piece that we're looking for is the federal funding to get replenished, and then also figuring out how we collectively create some solutions so we can maximize businesses opening up. So everybody be well. Obviously, we'll contact you by email, and we hope to see you guys soon. Thanks.